patients will frequently say they've had sinus issues their whole lives. And it's difficult for them to have a clear understanding of what's actually going on inside their nose. The sinus cavities are cavities outside of the nose, and then the nasal cavity itself may have some structural problems which are producing their complaints as well. To be able to resolve their sinus complaints when they arrive at the office with that complaint, we really have to elucidate what's bugging them. Does that mean postnasal drip? Does it mean that they have facial pressure or facial pain? Does it mean they get recurring sinus infections? Does it mean that it's difficult to breathe at nighttime? So as we go through what their subjective complaints are, we end up combining that with really cool objective measurements. A mini CT scan is done in the office, which gives us a beautiful understanding of what's going on both inside of the nose itself as well as what's going on inside the sinus cavities. Is there sinus infection, for example, or the sinus outflow tract secluded? Are there structural problems like a deviated septum? Have they developed intranasal polyps? We can look endoscopically with a high-definition telescope painlessly to get a beautiful view of the cross-sectional diameter of the airway, and also to look for things like evidence of infection or allergic change, if we can have an idea that it may be allergic in nature. Look at how the nostrils function. Do they collapse? Is there nasal valve issues where the nostrils are tending to collapse in when they breathe in? When we combine those diagnostic studies with a good physical exam and history, along with testing, such as the allergy testing, which we can do in the office typically at the same visit, we really understand the why much more comprehensively and can tailor a plan that's specific to the cause or causes. That's really why we get such, I think, much better results from our patients when we see them in terms of getting the resolution of their complaints.